Excess weight is closely associated with an increased risk of numerous musculoskeletal conditions. Physiotherapists, with their diverse skill set, are well equipped to help manage these issues, significantly improving patients' pain, function, and overall quality of life. However, research indicates that most individuals with excessive weight do not seek their assistance, and those who do often delay treatment by several months or even years, which is a problem since this delay likely allows their conditions to progressively worsen over time. Therefore, today we want to explore why individuals with significant excess weight might avoid seeing a physio, despite the profession being a cornerstone in effectively addressing the musculoskeletal problems. But first, as always, please take note of our disclaimer. In no particular order, number one is the time commitment involved. We think everyone would agree that since this is someone's health we're talking about here, the time needed to invest in attending therapy sessions is worthwhile. But you must be aware that for many, it's not just a nice opportunity to skip work early. Many people will actually struggle getting their boss to give them time off for it, finding a minder for their kids, or with taking time away from the 99 other responsibilities they have to prepare themselves, travel back and forth, and spend time at the sessions once or twice per week for potentially several weeks. Indeed, this applies to people of all BMI ranges, not just those who are overweight. But something that can make it even harder for this population, especially, is that they're more prone to further health burdens like type 2 diabetes or depression that require the assistance from other health providers too. So, going to see a physio when they have to already see a doctor, a psychologist, or both often might prove too much of an uphill struggle. Next is the cost. A lot of you might be fortunate enough to have a physio paid for by your work or government fully or at least in part. But unfortunately, many others come from places or are in situations where they don't have that luxury. As a result, they'll need to pay out of pocket, which could become very costly, especially when, again, they might already be paying fully or partially for other medical expenses. Keep in mind that financial constraints are a further consideration for meaningfully overweight people, since increased weight status is often linked to having a lower socio-economic status. One study found that men at the lowest socio-economic status have nearly twice the likelihood of becoming obese. One reason for this, besides education and healthcare access, is that processed calorie-dense foods are often cheaper and more accessible than foods with good nutritional value. On a quick side note, if you are interested in undertaking our evidence-based and results-backed personalized Plato weight management program, please click the link in the top right-hand corner of the video or follow the link in the description. Moreover, the third barrier is the fear of negative judgment. That's because there's a stigma associated with being considerably outside of a normal BMI. A study by Poole and Hoover in 2009 suggests that there are widespread negative stereotypes that overweight and obese persons are lazy, lacking in self-discipline, selfish, impulsive, or a combination of each. If you are one of the concerning people, I'm sure you'll be at least aware of it, if not already experienced it yourself at various points. As a consequence, as weight goes up, self-consciousness can too, generally speaking. In one study, one woman recounts going only for a walk at 5 a.m. when it was dark to avoid people seeing her. That's just a small example of the extent some people will go to in order to manage the fear of judgment associated with being meaningfully overweight. And you can often see this fear regularly manifesting itself even in their demeanor too. It's often the case that meaningfully overweight people will adopt more closed or constrained postures by sitting on the edge of a seat, leaning forward more cautiously, having their arms or legs crossed, or all of the above, as a way to minimize the perception of taking up space and reduce exposure of their midsection. This is in contrast to people who are comfortable with their body weight that tend to sit more freely with an open and relaxed posture, doing things like leaning back, draping their arm around the back of a chair, or resting comfortably on an armrest. So how does this relate to physiotherapy? Well, if people feel self-conscious about their weight, even in everyday situations where they remain fully clothed, it's easy to imagine how much more self-conscious they might feel during physiotherapy, which often requires the removal of clothing. And unfortunately, the negative stigma that these overweight people could face if they do see a physio won't always be just in their heads. In the conclusion of a systematic review on the subject, the researchers actually went as far as to say that this is common in the profession. Of course, this is not to suggest that all or most healthcare providers respond negatively, make inappropriate or unnecessary comments, or show less patience or empathy toward individuals seeking their assistance. However, it is likely that some do. This potential for negative experiences may deter overweight individuals from seeking physiotherapy for their ongoing musculoskeletal pain, especially if they've had a discouraging or unpleasant encounter in the past. Furthermore, many people with significant excess weight may fear embarrassment, whether from struggling to perform simple movements or exercises that are easier for individuals of a lower weight, or from being perceived as weak due to challenges with strength or conditioning. Lastly, adding to the fear of judgment by physios is the increased likelihood of anxiety symptoms and conditions meaningfully overweight people experience that can exacerbate that. It's been suggested that obese persons are at the 30% increased risk of an anxiety disorder and are at a 40% increased risk for anxiety symptoms like blushing, sweating, a rapid heart rate, feelings of sickness in the stomach, etc. One of the reasons for this goes back to the prevalence of negative stereotypes meaningfully overweight people face, since they can be very distressing, especially when they've been repeatedly experienced over the years. Therefore, all of these factors combined could be preventing meaningfully overweight people from seeking physiotherapy. But what's your thoughts on this? Have you any suggestions to help? We'd love to hear from you in the comments section down below. So that has been our video. Thanks for watching, and I'll see you next time.